Welcome students to our new YouTube channel Pharmatech, the division of excellence. So let's start the next chapter from central nervous system, which is antidepressant agents. So let us start to this topic, antidepressant agents. In that we first see the antimanic drugs, and the example of antimanic drugs are lithium, carbamazepine and clonazepam. And the most common type of depression is the reactive or secondary depression. So the secondary depression is the most common type of depression. So next see the classification of antidepressant agents, and the first one is Mao inhibitors. And in Mao inhibitors, first one is non-selective Mao inhibitors, and the examples are isocarboxide, phenylazine and tranylcypromine. And the second one is isoenzyme selective, and there is Mao A, and example is clogrelin and moclobemide. So the isoenzyme selectives in Mao A inhibitors, examples are clorgelin and moclobemide, and the Mao B isoenzyme selective in Mao B is example is selegiline, and this selegiline is also known as deprenyl, and it is used in Parkinson's disease, and also in it do not depression. So this selegiline is not used in depressions. So next we see the cyclic compounds. So the first one is monocyclic, and the example of monocyclic compound is topinacin. So topinacin is monocyclic, and the next one is bicyclics, and the example of bicyclic is viloxazine, and third one is tricyclic, and the examples of tricyclics are imipramine, amitriptyline, nortriptyline, trimipramine, clomipramine and doxepin. So these all drugs are tricyclic, most important for GPAT. Any one drug is asked for type which cyclic this compound. So tricyclic compounds are imipramine, amitriptyline, nortriptyline. So all triptylines are tricyclics, and also trimipramine and clomipramine. So pramine is also tricyclic, and doxepin is also tricyclic. So the next one is tetracyclic, and the examples are amoxipine and minaserine and maprotilene. And the atypical cyclic compounds are trazodone and fluoxetine. That means that atypical cyclic compounds are trazodone and fluoxetine. So next we see the classification based on reuptake inhibitors. So there is first one is noradrenaline and serotonin, Na 5-HT reuptake inhibitors, and the examples of noradrenaline and serotonin reuptake inhibitors are imipramine, trimipramine, doxepin, clomipramine, amitriptyline and dothepin. So these are all noradrenaline and serotonin reuptake inhibitors. So next class is noradrenaline reuptake inhibitors, and the examples of noradrenaline reuptake inhibitors are nortriptyline, amoxapine, protriptyline and desperamine. So these nortriptyline, protriptyline, desperamine and amoxapine are the examples of noradrenaline reuptake inhibitors. So next we see the selective serotonin reuptake inhibitors, and the example of selective serotonin reuptake inhibitors are fluoxetine, fluoxamine, paroxetine, sertraline, and that means sertraline and citalopram. So all these drugs like fluoxetine, fluoxamine, paroxetine, sertraline and citalopram are the selective serotonin reuptake inhibitors, that means 5-HT. And the next class is atypical antidepressants, and the examples of atypical antidepressants are trazodone, bupropion, minaserine and tineptine. So these are all atypical antidepressants. So next we see the drugs causing depression. So the first one is anti-hypersensitive drugs. That means antihypertensive drugs. And the example of antihypertensive drug is reserpine. It is most important antihypertensive drugs is reserpine. And also methyl-dopa, clonidine, propranolol and pindolol. So they are antihypertensive drugs causing depression. And the next one is anticonvulsants, and in that the Parkinsonism drug is levodopa and also cimetidine, phenfluramine in withdrawal and hormones. So the next we see the Mao inhibitors. So in Mao inhibitors, types of enzymes and sites where they present, and the first one is Mao A, and the sites are peripheral adrenergic nerve endings, intestinal mucosa and in placenta. The Mao A inhibitors are present, and the Mao B inhibitors are present in brain and also in platelets. The brain, it is the organ containing both isoenzymes and liver. So next we see the uses of Mao inhibitors. Mao inhibitors used as antidepressants. The isocarboxide, phenylazine, tranylcypromine and moclobemide are the Mao inhibitors. So next safest Mao inhibitor is isocarboxide. So in GPAT there is a question ask which is the safest Mao inhibitor, and the correct answer is isocarboxide. And the next we see the quickest acting Mao inhibitor is tranylcypromine. And next is Mao inhibitors used in Parkinsonism is selegiline. So this selegiline is used in Parkinsonism, that means in Parkinson's disease. It is also Mao inhibitor. So next we see the adverse effects, in that the cheese reaction seen with Mao inhibitors due to presence of tyramine or dopa. So next we see the tricyclic and related antidepressants. First one is actions on CNS sedation. First is highly sedative antidepressants, and the examples are trazodone, doxepine, amitriptyline and trimipramine. So these trazodone, amitriptyline, trimipramine and doxepine are the highly sedative antidepressants. So next we see the least sedative antidepressants, and the examples are protriptyline, fluoxamine, fluoxetine and desipramine, and that means desipramine. So these all protriptyline, fluoxetine, desipramine and fluoxamine are the least sedative antidepressants. So next we see the inhibition of 5-HT uptake responsible for sedation. That first one is ANS, autonomous nervous system. In that there is anticholinergic actions, and also the antidepressant with high anticholinergic property, and the examples are clomipramine, amitriptyline and trimipramine. And also the antidepressant with least anticholinergic property, and the examples are trazodone, fluoxamine, desipramine, fluoxetine, that means fluoxetine, bupropion and amoxipine. These are all antidepressant with least anticholinergic property. That means the drugs like trazodone, fluoxamine, desipramine, fluoxetine, bupropion and amoxipine. So these all antidepressant with least anticholinergic activity. We revised because these are most important tricyclic and related antidepressants. So next we see the CVS, that means cardiovascular system. In that the least cardiotoxic antidepressant is minaserine. That means drug of choice in depression with heart disease is minaserine. So there is in GPAT two questions asked from this, that is least cardiotoxic antidepressant and drug of choice in depression with heart disease, and the right answer is minaserine. So next is hematologic. So in hematologic, it is antidepressant causing hemolytic anemia is nomifensin. So the nomifensin is the hematologic antidepressants causing hemolytic anemia. So next we see the mechanism of action. It acts by inhibiting the reuptake of amines, that means noradrenaline and 5-hydroxytryptamine. So next we see the half-lives period. The antidepressant with longest life are the protriptyline. There is 54 to 198 hours is the longest half-life of protriptyline, and the next one is fluoxetine. There is 24 to 96 hours, and second one is antidepressant with shortest half-life, and the examples is trazodone. Its shortest half-life is 4 to 8 hours. So next one is antidepressant which also has antipsychotic property, and the example is amoxipine. So this amoxipine antidepressant has antipsychotic property. So the next is most rapidly acting antidepressant is also amoxipine. So this amoxipine is most rapidly acting antidepressant. So next we see the highly selective 5-HT reuptake inhibitors, and the example is fluoxetine. So next we see the drug whose antihypertensive action is reversed by tricyclic antidepressants is guanethidine. So in GPAT also question is asked, the drug whose antihypertensive action is reversed by tricyclic antidepressant, and the correct option is guanethidine. So the next we see the dosage regimen of Mao inhibitors is monitored by measuring the inhibition of Mao activity in platelets. So next we see the drug is lithium, and its uses are it is in acute manic episode. The lithium added 5 to 7 days later. Drug of choice is neuroleptic plus diazepam. So this lithium is also neuroleptic, that means in anti-manic, and also in is diazepam. So both the uses of lithium. So next uses is in prophylaxis of manic depression psychosis, most common indication for lithium. So we say that this lithium is anti-manic drug because this is used in manic depression, so and also in psychosis. So next we see the adverse effects of lithium. The adverse effect of lithium is, first one is renal adverse effects, and the most important renal adverse effects is the antidiuretic, that means hormone ADH resistant nephrogenic diabetes insipidus, and the drug used in the treatment of lithium induced diabetes insipidus is amiloride. So in GPAT the question is asked, the drug used in the treatment of lithium induced diabetes insipidus, and the correct answer is amiloride. So the next is earliest indicator of renal dysfunction is low specific gravity of urine. So next is CNS adverse effect. So the adverse effect of central nervous system is, first one is first sign of lithium toxicity, and there is increased deep tendons reflex and muscle fasciculation, and also the tremors and choreoarthrosis are these tremors and choreoathetosis are the adverse effect of central nervous systems, and also lithium toxicity. So in GPAT the question is asked, which is the first sign of central nervous system adverse effect, which is lithium toxicity. So next we see the cardiovascular system adverse effect. There is reduced amplitude of T waves, and in cardiovascular system, there is reduced amplitude of T waves is the adverse effect of this cardiovascular system. So next we see the thyroid dysfunction. In that the lithium causes goiter and hypothyroidism, and also the blood level at which the lithium toxicity develops above 2 mil equivalents upon L, that means liter. So in thyroid dysfunction, lithium causes goiter and hypothyroidism, and also the blood level at which lithium toxicity develops is above 2 milliequivalents per liter. So next we see the drugs which causes neutrophilia and leukocytosis are the lithium and glucocorticoids. So the NGPAT also question asks which drug causes neutrophilia and leukocytosis, and the correct answer is lithium and glucocorticoids. So here is the end of this chapter, antidepressant agent. So hope you like this video. If you like this video, please comment and please share this video more and more to your GPAT aspirant as well as CET aspirants, and please like, share and subscribe to our channel for latest updates, and please stay connected with PharmaXTech channel. So thanks for watching this video. Thank you for watching. Stay updated. Thank you. Stay tuned. Welcome students to our new YouTube channel PharmaTech, the